Okay, let's talk about something that feels really personal for so many people listening, hair fall.
Hmm.
Especially for women. It's just so tied into our sense of self, our identity. And, losing a lot of hair can be incredibly upsetting, frustrating.
Yeah, even isolating sometimes.
Totally. So if you're out there dealing with thinning hair or, more visible loss, please know this. You are so not alone.
That's such an important point to start with. And today, what we're doing a deep dive based on a specific source, an article from Truth Up Front that really gets into this.
Right. And our mission really is to unpack it. We want to pull out the key nuggets of knowledge, understand the science they present, and look at the causes and maybe some solutions from the article.
And, a critical thing the source stresses right away
Yeah.
is that figuring out the cause,
Yeah.
that's everything.
Yeah, it's the absolute key to finding a fix that actually works for you. No single magic answer.
Exactly. So first things first, the basics. The source reminds us, look, everyone loses hair every day. That's totally normal.
Yeah.
Part of the natural cycle.
Right, losing some hair isn't the problem. It's when it becomes, excessive. The article suggests maybe losing more than about 100 hairs a day consistently.
Uh-huh.
That could be a sign that something else is going on.
And that something else, as the source points out, could be a whole range of things. Lifestyle stuff, diet, styling habits, or, actual medical conditions.
Which brings us back to why pinpointing your specific cause is just so crucial for getting anywhere.
Spot on. So let's dig into the main reasons the article highlights for hair fall in women. The big ones that science seems to back up. First on the list, hormonal imbalances.
Hormones. They run so much, don't they?
They really do. And they have this powerful role in the hair growth cycle. The source explains that shifts, especially in androgens, those hormones people often call male, but women have them too, just less.
Mm-hmm.
Well, shifts in those can actually make the hair follicles smaller over time.
Yeah.
And that leads to thinner hair, less overall volume.
And the source links this to some really common situations, right? Like PCOS, polycystic ovary syndrome.
Yeah, that's one. Also menopause, that whole period after pregnancy and childbirth, and even thyroid disease.
So how do these hormone changes actually do that, affect the hair?
Well, basically, these big fluctuations can kind of interrupt the hair's normal schedule. They can shock a bigger chunk of your hair into the resting phase, the telogen phase, sooner than usual.
The shedding phase.
Exactly. So more hair falls out around the same time, making the loss more noticeable.
Okay. So moving on from hormones, the article also talks about genetics.
What?
Female pattern hair loss.
Yes, a major hereditary cause. The medical term is androgenetic alopecia. And the way the source describes it, it's usually this slow, gradual thinning,
Where does it typically show up?
often most noticeably right on the crown, or sort of the top vertex area of the scalp.
And the article mentioned it often becomes more obvious after 40 and looks different from male pattern baldness, more spread out.
That's right, more diffuse thinning usually. But the good news, according to the source, is that treatments like minoxidil can help manage it.
Okay, good to know. Now let's shift gears to something, probably relatable for many. Stress and mental health.
Mm-hmm. The source connects stress, both physical and emotional, to a condition called telogen effluvium.
Telogen effluvium.
Right.
That's where a big shock to your system pushes lots of hair into that resting phase prematurely.
Exactly. The article lists things like, major physical trauma, surgery, but also really tough emotional events like divorce, losing a job, deep grief.
Yeah.
But here's the really interesting part. The source highlights the timing. You might go through that incredibly stressful period, but the hair loss itself, it often doesn't show up for another 2 or even 3 months after the event.
Wow, that's quite a delay.
It is, and it can last for several months too. It's like your hair cycle is playing catch up to the stress.
Okay, something to keep in mind. What else? The article pointed to nutritional deficiencies, right? Sometimes overlooked.
Absolutely. This is a big one. If your diet isn't giving your body the essential building blocks, your hair health can really take a hit.
Makes sense. What nutrients are key, according to the source?
It flags several. Iron, vitamin D, vitamin B12, zinc, and making sure you get enough protein.
And I remember it specifically calling out iron deficiency.
Yes, as one of the most common causes, especially for women during their reproductive years. That's a really important detail.
Definitely. Okay, what about things we do to our hair? Styling habits? Chemical treatments?
Oh yeah, the source is pretty clear that how we handle our hair day to day can contribute.
Like what specifically?
Well, things like using flat irons or curling irons all the time, heat damage, or wearing hairstyles that constantly pull really tight, like super high ponytails, tight braids. That can cause something called traction alopecia.
Literal hair loss from pulling.
Exactly. And then there are the chemical processes, bleaching, perming, relaxing treatments.
Right. How do those cause loss?
Over time, these things can just weaken the hair shaft, make it brittle, more prone to breaking. And sometimes they can even damage the root or follicle, which increases actual shedding.
Okay, so be gentle with your hair. What about things we put in our bodies? Medications.
Yes, the source reminds us that hair loss can be a side effect of certain medications or medical treatments.
Which ones did it mention?
The big one is chemotherapy, obviously, but also certain antidepressants, some blood pressure meds, even some types of birth control pills, and acne treatments like isotretinoin.
So what's the advice there?
Pretty straightforward.
Yeah.
If you notice more hair falling out after starting a new prescription,
Yeah.
definitely talk to your doctor. Don't just stop taking it, but have that conversation.
Good advice. Now, we mentioned thyroid disorders with hormones, but the article brings them up again.
It does, yeah, because the thyroid's impact on hair is pretty significant. Both underactive hypothyroidism and overactive hyperthyroidism can mess with the hair cycle.
And what might you notice?
General thinning, maybe hair feeling really dry or brittle, or just growing much more slowly than usual.
And the fix?
Well, first step is diagnosis, usually a simple blood test. And the source says treating the underlying thyroid issue often improves hair health considerably.
Okay. Then there are autoimmune diseases. That sounds complex.
It can be. The article uses alopecia areata as a primary example. That's where your immune system basically gets confused and attacks your own hair follicles.
What does that look like?
Typically, sudden patchy hair loss, often smooth, round patches on the scalp, but it can affect eyebrows, other body hair too.
Is it permanent?
The source notes it can be unpredictable, but it may be reversible with treatment. And it also mentions other autoimmune conditions, like lupus, can sometimes cause hair thinning as well.
Right. Okay, one last area from the source. The scalp itself. Infections and conditions there.
Absolutely vital. Scalp health and hair health are directly linked. Things like severe dandruff, psoriasis flare-ups on the scalp, or fungal infections.
Yeah.
They create inflammation and an unhealthy environment. This can actually irritate or even damage the hair follicles, blocking healthy growth.
So what should you look out for on your scalp?
The source lists things like persistent itching, scaly patches, redness, inflammation, or even little bumps that might have pus.
Oh.
Yeah. The solution there usually involves treating the specific scalp problem, maybe with medicated shampoos or seeing a dermatologist. Clear off the scalp, give the hair a chance to recover.
Wow. Okay. That is quite a list of potential reasons. So if you suspect something's up, the source is really clear on the next step. Find out the exact cause, and it strongly advises don't make assumptions.
That's so important. Trying to guess what's causing your hair loss is, well, it's really tough. So many things can look similar.
So professional help is key.
Definitely. The source recommends consulting a dermatologist, or even better perhaps, a trichologist.
A trichologist? What's that exactly?
Think of them as a hair and scalp specialist. They have really specific training in these areas, often working closely with dermatologists. They might do things like a scalp biopsy.
Which sounds scary, but is it?
Nah. It's usually just taking a tiny little skin sample to look at under a microscope. Or they'll order specific blood tests to really zero in on the cause.
Okay, so what kind of tests are we talking about?
Well, the article mentions checking hormone levels, especially if you have other signs, like irregular periods or acne, and definitely getting blood work done for a nutrient analysis, checking those iron levels, vitamin D, B12, zinc, all that stuff.
Right.
And sometimes they might even do a simple hair pull test right there in the office, just to see how much hair is actively shedding.
Got it. So let's say you've done that, you've seen a professional, you have a better idea of why this is happening.
Yeah.
What does the article say about solutions and treatment options? How do you fight back?
Okay, so it covers a few areas. First, medical treatments. Minoxidil gets mentioned again. It's FDA approved for female pattern hair loss. You can get it over the counter.
Okay.
Then there's finasteride. The source notes it's not technically approved for women for hair loss, but doctors sometimes use it off-label in specific situations.
Interesting.
Hormone therapy could be an option if, say, PCOS or menopause is the trigger. And for autoimmune stuff like alopecia areata, corticosteroids might be used.
What about if the tests showed a deficiency?
Right, the nutritional supplements come in. The source suggests that correcting deficiencies in things like biotin, iron.
But carefully with iron. Yeah,
Yes,
right?
absolutely. Talk to your doctor before starting iron supplements. Getting the dose right is crucial. Also, omega-3s and vitamin D are mentioned. Getting those levels back up can often lead to regrowth.
Okay. Beyond pills and prescriptions, what about just everyday hair care? Does the article give tips?
It does, yeah. Some really practical stuff like using a gentle sulfate-free shampoo, trying not to brush your hair when it's wet and most fragile,
Mm-hmm.
really cutting back on the heat, styling blow dryers, flat irons. And it even mentions regularly oiling your hair, maybe with coconut oil or a castor oil, could be beneficial.
Interesting. What about natural remedies? Does the source touch on those?
It does, acknowledging that while the hard scientific backing isn't always as strong as for medical treatments, some people do find them helpful.
Like what?
It lists things like applying aloe vera, believe it or not, onion juice.
Onion juice. Really?
Yep. Rosemary oil, another popular one, and using green tea rinses on the hair.
Huh. Any warnings there?
Yes, the source definitely adds a note of caution. Be careful, especially with sensitive skin. Always do a little patch test first before putting something all over your scalp.
Smart. Okay, now, can you actually prevent hair loss? Or at least lower your risk? The article talks about preventative steps.
Yeah, and a lot of these are basically about overall good health, which, supports healthy hair too.
Makes sense, like what?
Eating a balanced diet, getting all those key nutrients we talked about, staying hydrated, drinking plenty of water, regular exercise,
The usual suspects for good health.
pretty much. And also, if you smoke or drink a lot, cutting back or quitting, managing stress is huge.
Back to stress again.
Always. So things like yoga, meditation, maybe therapy, and getting enough sleep. The source recommends that classic 7 to 8 hours a night.
It all kind of ties together, doesn't it? Body health, hair health.
Exactly. These habits might not stop genetic hair loss in its tracks, but they create the best possible conditions for your hair.
Okay, last crucial point. When is it really time to stop trying things at home and definitely consult a physician? The article gives clear triggers.
Yes, very clear. Go see a doctor if your hair loss is sudden, really abrupt, or if it's coming out in noticeable patches.
Okay.
Also, if the hair loss is happening along with other symptoms, you can't explain like unusual fatigue or weight changes. If it just keeps going on, even though you feel like you're taking good care of your hair.
Right.
And this is really important. If it's seriously impacting your self-esteem, how you feel about yourself, or your general mental well-being, don't suffer in silence.
That's such good advice. So wrapping this all up, the core takeaway from this Truth Up Front article feels, well, actually kind of empowering.
I think so too.
Hair loss is frustrating, it's personal, we get that. But it often is manageable. And the absolute key, as the source hammers home again and again,
Is knowing the cause.
exactly. Understanding that underlying reason, whether it's hormones, nutrition, stress, illness, whatever that knowledge, gives you the power to make smart choices.
Which is about treatment, about lifestyle changes, about seeking the right help.
The source ends with a really nice thought.
Hmm.
Every woman's hair journey is unique. There's no one-size-fits-all fix, but
But with patience, getting good professional advice, and being consistent with the right care, healthy hair is possible.
it's definitely a complex picture, but hopefully breaking down these different angles from the article helps you see it a bit more clearly. And maybe a final thought to leave you with, going back to that idea of hair and identity, knowing all these potential biological roots, these environmental factors, hormones, stress, diet, scalp health, does understanding that maybe change how you approach this? Does it shift it perhaps from feeling like some kind of personal failing to seeing it as, well, specific health or lifestyle factors that you can actually investigate and potentially manage? Something to think about.